Hi, my name is Abby. I am in the Women's Health NP program. I'm in my 4th out of 6 terms, and I'm currently sitting in my empty apartment because we're moving from Texas to Colorado tomorrow. So I decided to do the case study 8.2, question number 2 on page 194 of our textbook. A brief summary of the case study is that there's a state-funded clinic that sees patients for things like STI testing, STI treatment, contraceptive counseling, annuals, different things like that. They do host students. However, lately the school has threatened to pull the students and complain that they're not getting as much experience as they should be because of low patient volume. So the clinic runs by appointment only, but they've noticed after some research that over half of their appointments end in no-shows, so they want to switch to walk-in only. So the question is, describe a proposal to evaluate the change in scheduling at this clinic. What type of data would be important to collect as part of the eval? So first, as we already know, as nurses and soon to be advanced practice nurses, evaluation is key to any policy change in any field, and arguably, especially healthcare. According to our textbook by Nancy Short, evaluation informs decision makers about the effectiveness of an intervention, monitors sustainability of the intervention, and guides future improvements for the healthcare facility. Also, this clinic is run by an advanced practice nurse in the case study, and we all know that as nurses, we're taught from early on in nursing school that to constantly be evaluating, whether that be if we're following a policy, whether that be how our patient is doing. It's part of the basic nursing process. So who better to lead this policy change than the advanced practice nurse that is running this clinic? And our textbook also touches on this aspect on page 179. So as far as my opinion, I think that instead of switching fully to walk-in only, I think that they should switch to a mixture of some appointment slots and then also allow for walk-ins. A patient might want to schedule an appointment because it could possibly decrease their waiting time, so they should be given the option, I believe. If they go to walk-in only, I think they could lose some clientele potentially. This case study also mentions that they want to use social media to market their changes in scheduling and also just market their clinic in general. So I think on their social media pages, they should include an option for patients to survey or poll their opinions on the schedule change. Maybe existing customers could provide a satisfaction score out of 10 with the previous way, which was appointment only. And then again, maybe 3 to 6 months after the implementation of the walk-in only schedule, give another satisfaction score, see how those compare. Or maybe patients could do a survey of their experience every time they come in. Maybe they could say, what was their wait time? What was their face time with the provider? Did they get what they came for? Was it a convenient time of day for them? Was it a convenient day of the week for them? Just different questions to kind of evaluate how the population is liking this new change or not liking this new change. Another thing that they should do kind of from the beginning is maybe call the frequent no-showers and ask for reasons for the no-show, and then maybe make some changes based off of those answers. Are there hours of operation? Could those be improved? Whatever those answers may be to why these patients are no-showing. They need to know how many appointments were on the schedule per week when they were doing appointment only, and then they need to know also, once they implement the change, how many appointments are coming in per week walk-in. What is the difference? Is there actually an increased amount of patients as they were hoping? Another question I could ask is, could they possibly do appointment or walk-in to start and then transition, like appointment plus walk-in scheduling to start and then maybe transition to walk-in only once they know that maybe appointment plus walk-in doesn't work because maybe it yields too much traffic, too long of wait times. They should also ask the school with the students how many patients a week that they would be comfortable with their students seeing if they felt that the clinic previously had low volume, and then see if they're hitting that mark with the walk-ins. So I found an article, it was written in 2020, it's called Managing Appointment-Based Services in the Presence of Walk-in Customers. Basically, they're saying that the optimal number of patients needs to be established in order to fully benefit from a system and be able to sufficiently evaluate. So first they need to know what is their goal. They also need to evaluate wait times, provider idle time, and potential provider overtime as well, according to this article. And then I found another article called A Modified Walk-in System versus Scheduled Appointments in a Secondary Prosthetic and Orthotic Clinic. They found that direct waiting times was 9 minutes longer for modified walk-in schedules than for appointment schedules. So they actually found that walk-ins maybe yielded a higher waiting time, which would yield lower patient satisfaction. But they also found that staff reported more support from coworkers with a walk-in schedule than an appointment schedule. And then I also feel that walk-ins are a good option because they could bring in patients that don't want to have an appointment on their calendar for maybe an STI test because maybe they don't want their parents to see it on their calendar. Maybe they don't want their friends or their significant other to see it on their calendar just yet. And so there are different pros and cons to each way of scheduling. So lastly, I want to end with, according to our textbook by Nancy Short, changing to a scheduling system that better suits both the patient population / community and the clinic's goals to help achieve the quadruple aim of improvement of healthcare systems is basically the optimal standard. So the quadruple aim is improving quality of patient care, reducing healthcare costs, improving population health status, and maintaining or even improving job satisfaction for healthcare workers. So finding a way that meets that quadruple aim is what's going to ultimately be best for the clinic, whether that's appointment, walk-in, or a combination of the two. Thank you.